Over the age of 65, falls are quite common and can lead to some life-altering consequences. Some of these consequences can be hip fractures, traumatic brain injuries, and can lead to some permanent disabilities. This can lead to prolonged hospitalizations, nursing home admissions, all which may result in a loss of independence for you or your loved one. Fortunately, there are some things that can be done to decrease your chance of falling. Communicating with your doctor is a great first step in promoting your safety and decreasing your chance of falling. Discuss with your provider any unsteadiness that you have on your feet. That way, together, you can come up with a collaborative plan to promote your safety and decrease your chance of falling. You should take this opportunity to talk to your provider about the medications that you're taking. Some medications may lead to drowsiness, dizziness, and may need to be adjusted as we age. So, take your medication as prescribed. Make sure that you don't skip a dose or accidentally take a dose twice. This can be very dangerous. This can easily be avoided by using a pill separator. Having your vision checked regularly can ensure that you have the correct prescription. This can help with your depth perception and help you to see obstacles that are in your way. Decreased sensation can occur in our feet as we age. Having your feet checked regularly can avoid any potential accidents. Exercising can greatly improve your balance, strength, and flexibility. A physical therapist can recommend appropriate programs such as Tai Chi and a matter of balance based on your activity and comfort. Surprisingly, most falls occur in the home. Some simple home modifications can improve your safety and decrease your chances of falling in your home. Many organizations, such as the Office of Aging, can assist with low or no-cost modifications, such as grab bars for your bathroom. Plugging in night lights near your bed and bathroom, removing slippery rugs, and placing your commonly used items within reach in cupboards are all examples of quick home safety modifications you could do.
There is a relationship between high-risk medications and the increased risk of falls in our elderly population. One key factor that a lot of people might not immediately consider as a primary culprit of falls is medication, yet so many different medications, especially when combined, significantly increase the risk of falls. I wanted to talk about some of these medications to look out for. A major class of medications that's been linked to falls is sedative hypnotics. These are used to treat anxiety and insomnia. This includes benzodiazepines such as Xanax and Ativan, as well as non-benzodiazepine sleep aids like zolpidem, aka Ambien. So next is opioids. These are used to treat pain such as oxycodone, morphine, tramadol, or Norco. And then we have muscle relaxants used to treat muscle spasms and back pain like baclofen and Flexeril. Lastly, antihistamines such as diphenhydramine, also known as Benadryl, that are prevalent in so many different over-the-counter medications, including Tylenol PM and NyQuil. All these medications, when taken alone, and especially when taken together or taken in excess, can cause sedation, weakness, confusion, and impair balance, increasing the risk of falls by twofold. Never take any of these or any medication with alcohol, as this can make these side effects even worse and cause so many different harmful effects. So what can we do about this? First, your awareness is paramount. So if you or a loved one is on one or any of these medications, it's really important to be informed of the potential risks and side effects, including all of these different over-the-counter medications. And if a medication seems to be causing dizziness, drowsiness, or any change in cognition or thinking, it should be addressed immediately. Over time, as health conditions evolve or the body changes, medication needs can also change, and that's okay. Advocate for regular and thorough medication regimen assessments for you and for your loved ones with your providers. Always ask your provider before starting any new medication, and when in doubt, ask your pharmacist and doctor, because oftentimes less is more.
In the United States, the CDC's statistics shows that 1 in 3 elderly adults fall annually. If someone falls, it doubles the chances of falling again. 1 in 5 falls will result in a broken bone or a head trauma. Every year, 3 million older adults are treated in emergency room for falls. Over 800,000 patients a year are hospitalized because of a fall injury, most often because of head injury or hip fracture. The consequences of falls go beyond physical injuries. They can lead to a loss of independence, reduced quality of life, and profound sense of fear and anxiety among older adults. The fear of falling again can limit their activities, leading to social isolation and a decline in overall well-being. We must recognize that falls not only affect the individuals who experience them, but also impact families, caregivers, and our healthcare system. Hospital stays, rehabilitation, medications, and ongoing care can place a tremendous burden on our healthcare system. Furthermore, the emotional toll on families and caregivers is immeasurable. So it's our responsibility to raise awareness, promote preventive measures, and support policies that prioritize the safety and well-being of our elderly population.
Although some falls are not avoidable, the truth is, most are. By creating a collaborative plan and revised routine, we can decrease your chances of falling and help you maintain the independence that you not only enjoy, but deserve.